Next, example of teratogens and their effects of fetal development. Common teratogens include some medications, recreational drugs, tobacco products, chemicals, alcohol, and certain infections, and there's some cases, uncontrolled health problems in the pre-birthing parent. So, what is teratogens? Teratogens is a something something that can cause birth defects or abnormalities in a developing embryo or fetus upon exposure. Teratogens include some medication, again, medications, recreational drugs, tobacco products, chemicals, alcohol, certain infections, and there's some cases of health problems such as uncontrolled diabetes in pregnancy and pregnant people. Exposure to a teratogen can occur through ingestion or environmental exposure during pregnancy. Their effects of fetal development. Teratogen is a substance that may lead to birth defects in an fetus or embryo. During pregnancy, exposure to certain chemicals, infections, and drugs may increase the risk that a person will miscarry or that the embryo or fetus could have a developmental abnormality. Alcohol and smoking are two common teratogens. Um, the, while the embryonic period during which organogenesis takes place occurs between implantation at around 14 days to around 60 days post conception. This is usually the most sensitive period to teratogenesis when exposure to a teratogenic agent has the greatest likelihood of producing a malformation. Teratogens can begin affecting the developing embryo as early as 10 to 14 days after conception. During embryonic development, there are periods when the developing organ system show more sensitivity to teratogens, specifically if exposure to a teratogen occurred during the first 3 to 4 weeks of gestation, a neural tube defect such as spinal bifida or anencephaly may result. Um, Virus agents have been determined to not cause birth defects and are known as non-teratogenic agents. Example of non-teratogenic agents that commonly mistaken for teratogen include spermicides, acetaminophen, and prenatal vitamins. This picture is have or as we can see there's a background that something that can cause birth defects or abnormalities in a developing embryo or fetus. Exposure through ingestion, environmental atmosphere. So this is the teratogen can include some medications like alcohol, recreational drugs, infection, tobacco products, and also health problems, example, diabetes. So, um, and also chemicals that can affect during pregnancy. Um, Non-teratogenic agents include spermicides, um, acetaminophen, prenatal vitamins, and there's have a types. Um, First, alcohol affects central nervous system. So, is alcohol a teratogen? Yes, alcohol is a teratogen that can affect the central nervous system of the developing fetus. The central nervous system is sensitive to teratogens for the entire duration of pregnancy. And if alcohol is consumed at any point, there can be severe health problem or birth defects in the baby. It is recommended to avoid consumption of alcohol for the duration of pregnancy. Second, system um, about chickenpox. Is chickenpox a teratogen? Chickenpox can have teratogenic effects on a fetus. If a pregnant person develops chickenpox in the first 20 weeks of pregnancy, there is a slight risk of a rare but serious birth defect known as a congenital varicella syndrome. A fetus with congenital varicella syndrome is at risk of developing skin scars, abnormalities of the eyes, legs, arms, and brain, as well as gastrointestinal. If a pregnancy uh, is a pregnancy or if a pregnant person develop a chickenpox around the time of the delivery, the newborn may be at risk of life-threatening condition called neonatal varicella, which can result in severe or fatal illness of the newborn within a few days of delivery. Again, chickenpox rare but serious defect, congenital can affect congenital varicella syndrome, um, neonatal varicella. And also the next is BPA. Is BPA a teratogen? BPA or bisphenol A may potentially have teratogenic effects on developing fetus. BPA is a chemical found mainly in plastic and is often used in containers that store beverage and food. When exposed to heat, the BPA can leach into food and be ingested. At this time, it is unclear whether BPA has teratogenic effects on the fetus. Recent study conducted on mice hypothesized that BPA exposure during the last trimester of pregnancy can cause behavioral changes in the newborn after birth. However, no study have been conducted on human pregnancies. More research is required to clarify the exact relationship of BPA exposure and its effect on developing fetus. Most healthcare providers, however, do recommend limiting exposure to BPA during pregnancy. Again, potentially teratogenic in the last trimester. So, caffeine. Limit intake to 200 milligrams. Um, is caffeine a teratogen? Caffeine is not considered to be a teratogen. It is, however, a stimulant and diuretic which can cause an increase in individual blood pressure and heart rate. If consumed during pregnancy, caffeine can cross the placenta and can have similar effects on developing fetus blood pressure and heart rate. Current recommendation for caffeine consumption during pregnancy suggests limiting daily intake to 200 milligrams. So, there are the timelines of effects. Conception, week 0, 10 to 14 days. So, teratogen can begin affecting developing embryo. Conception is when a woman egg is fertilized by a man's sperm. After conception, it takes about 6 to 9 days for the egg to implant in the uterus. The next is the week 10, which is 3 to 4 weeks. So, teratogen exposure can cause neural tube defects. So, the week 20, which is or the first 20 weeks, chickenpox can result in congenital varicella syndrome. For baby, the risks depend on the timing. If chickenpox develop during the first 20 weeks of pregnancy, particularly between weeks 8 and 20, the baby face a slight risk of rare group of the serious birth defects known as congenital varicella syndrome. So after week 30, near delivery chickenpox can result in neonatal varicella. And chickenpox is an acute infectious disease. It is caused by Varicella zoster virus, which is a DNA virus that is a member of the herpesvirus group. After the primary infection, stay in the body, in the sensory nerve, um, ganglia as a latent infection. Primary infection with cause varicella. So the last is full gestation, week 40, the last week 40 duration, avoid consumption of alcohol. So that's all the example of teratogen and their effects of fetal development. Thank you.